When families watch an aging parent for cognitive decline, they usually look for the same set of behaviors: misplaced car keys, forgotten names, a story repeated for the third time in an hour. By focusing entirely on memory, we ignore the early indicators of the second most common form of dementia. Vascular dementia targets the brain's executive management system, the area responsible for planning and organizing, long before it touches the memory bank. Because a person can still recall a childhood vacation, loved ones assume the brain is healthy. The disease takes root under the cover of what looks like normal aging. The biological trigger for this decline comes from silent mini-strokes occurring deep within the brain tissue. We usually associate strokes with obvious physical signs, like slurred speech or facial paralysis. These mini-strokes lack those symptoms, making them invisible to the naked eye. While the patient looks healthy on the outside, compounding neurological damage is occurring internally. Each tiny blockage cuts off oxygen, permanently killing a microscopic cluster of brain cells. Compare the pathology of Alzheimer's to vascular dementia. Alzheimer's is a slow, steady, downward curve. Vascular dementia is a rigid staircase. Every sudden vertical drop represents a new silent mini-stroke. Brain function stays level, then plummets the moment a specific area takes damage. This localized damage often manifests as a specific kind of mental fog. The speed of their thinking drops, resulting in analysis paralysis. Suddenly, an everyday choice like ordering off a simple restaurant menu becomes overwhelming. You might also see sequencing issues. A master woodworker will pick up their tools, but abruptly forget the correct chronological order of the steps they've practiced for decades. They know exactly what woodworking is, and they remember their history with it. The fog shows the brain is struggling to process and organize information in the present moment. To spot the second sign, watch how they walk rather than listening to how they speak. Small vessel disease often causes a magnetic gait. The patient will shuffle, taking hesitant steps, complaining their feet feel heavy or glued to the floor. Their leg muscles are strong. The brain is failing to send the correct signal to move. The third sign involves sudden emotional shifts. Vascular changes can damage the regions of the brain that regulate mood long before memory is compromised. This frequently looks like a total loss of interest in social circles or hobbies. Unlike clinical depression, this apathy lacks any underlying feelings of sadness. It is an emotional flatness. On the opposite end of the spectrum is emotional lability. You will see inappropriate, sudden flashes of laughter, sudden bouts of crying, or extreme, out-of-character irritability over minor issues. These unpredictable personality shifts track with the staircase metaphor. A tiny stroke hits the emotional center, and a lifelong calm demeanor drops a step overnight. The fourth sign is nighttime disorientation. Compounding small vessel damage physically disrupts the brain's internal clock. As dusk approaches, patients experience sundowning, marked by sudden spikes in restlessness, confusion, and agitation. This broken internal clock fractures the sleep cycle. They wake up in the middle of the night disoriented about their location and the current time. At this stage, the disease severs the patient's anchor to reality and daily routine. There's a specific reason why families misinterpret these warning signs. The symptoms are patchy. Because the cognitive drops rely on which blood vessels are damaged at any given time, brain functionality fluctuates from hour to hour. A person might be perfectly sharp at noon, but find themselves completely lost and confused by 4 o'clock. This inconsistency gives families a way to rationalize the decline. When the confusion hits, they brush it off, assuming their loved one is merely having a bad day. We have to redefine the bad day. An overnight drop in a specific ability is not a mood swing, it is a permanent neurological shift. If you witness this step-like decline in someone you care about, stop waiting for their memory to fade. Treat sudden mental fog and shifting gaits as an active cardiovascular emergency happening inside the brain. Bypass the traditional memory tests. Seek out a specialist for brain imaging. While the damage from a stroke is permanent, identifying the cardiovascular cause is the only way to stabilize the decline and prevent the next drop in the staircase. It is the only way to preserve the brain's management system. Please like and subscribe for more health breakdowns, and I will see you in the next video.